I had years of living with having to chew on one side or the other, depending on what I had going on at the time. I had some poor dental health that some dentists had not done what they should in the past, and some fillings that had come out and that sort of thing, and was only able to chew on one side. I did have a bridge made for one side, and it was a pain because I kept having to put it in, take it out. It would get food underneath, and wasn't a pleasant thing. Went without it for most of the time. And once I started having more problems, I knew that I didn't want to do a bridge again. It was just a pain to deal with. And so that was when I started looking at implants.
When Kenneth came to see me, he had an infected lower left molar. He had a bridge on the lower right that was failing, and he was worried about the bridge coming out or falling out at any moment. And he really wanted to be pain-free and be able to eat again. The first thing we did when Kenneth came to see me was we took a 3D scan. This allowed me to see the bone and the anatomy and to see what was possible for dental implant placement. So when we looked at his case, we recognized that he had a couple of teeth that needed to come out, and he had a couple of spaces where teeth had already been missing. His plan required removal of a few of those bad teeth, and with plans for bone grafting. Bone grafting would allow for us to create a solid foundation to come back in the future and place dental implants to replace those missing teeth.
The surgery experience here was not a problem at all. I was concerned that there might be pain involved because they were going to be extracting teeth. They were going to be, I didn't know at the time, but they were going to have to do the bone graft, and I was never in any pain at all during the procedure or after. I was surprised how well it all went and how pain-free it was, and I couldn't be happier with the results.
It makes me feel really good to know that he's super happy with his outcome and that he feels like he can eat again, that he's not worried about the next thing failing or breaking. That's why we do it. So it just feels really good to hear that he's super happy with his outcome. And we're just thrilled for all of our patients here at the Texas Center for Oral Surgery and Dental Implants that we can provide this kind of outcome for them.
I would like to say thank you very much to Dr. Vickers. He has changed my life, really. I went a decade at least not being able to chew the way that I needed to, and I'm a much healthier version of myself because I can now chew the way that it was designed to begin with. So thank you, Dr. Vickers. Thank you.